Imperial for having me. And my name is Kautar, and I am delighted to share with you the story of a not only a colorful continent, but also a resilient continent named Africa. This is a disclaimer. So all the opinions and views that you will hear during this presentation are mine, are absolutely not the ones of the institutions and companies I am currently affiliated with. The countries that are mostly hit by the pandemic in Africa are South Africa and Egypt, followed by all the countries that you see on the map with a darker shade of green. The fatality rate in Egypt is less than 4%, and the fatality rate in South Africa is less than 2%. So this gives you an idea about the discrepancy between the rate of mortality that that we have unfortunately witnessed in Europe, which was 20%, versus the cumulative mortality rate that has been reported in the whole continent of Africa, which was 2%. So from these figures, we can qualify the African response to COVID-19 as, next slide, positive. And this was because of the early intervention in the continent, which has resulted in the virus containment, of course, obviously without its complete eradication. We have also seen a big resiliency from the population who stuck to the social distancing and the hygiene measures. Several African governments have implemented some kind of macroeconomic measures, be it cash transfer programs or in-kind transfer programs, which has resulted in a smoother economic recession, at least in the short term. We have also noticed a significant industrial resiliency from various governments in Africa, and particularly in North Africa, in Tunisia and in Morocco, where there has been a clear repurposing of the production of medical supplies, particularly the masks, which has been exported elsewhere, but also ventilators and tests, and I will touch upon this. We have also seen some other countries leveraging their technology and machine learning technology, more specifically, such as Rwanda, and also robotics. Next slide. Despite this positive response, we have noted a limited African involvement in the global R&D response to the COVID-19. We have only 3 clinical trials underway in the whole continent, 2 in Egypt for vaccines and 1 in South Africa. And even in terms of the readiness of the continent to upscale the manufacturing and to distribute the vaccine once it is available locally, there is a big question mark. This is a limited performance of the continent. There is also a limited performance or a heterogeneous capability in terms of manufacturing at scale of health medical supplies. And this has resulted in various shortages across the continent. There have been some. This slide is to show you that there has been a tremendous effort in building capabilities after the Ebola epidemic. The capabilities that were built across the continent are mainly in genomic capabilities and in virology. For the genomic capabilities, you have countries such as Nigeria, which has been able to perform a genomic sequencing of the COVID-19 virus or the coronavirus only 3 days after it has diagnosed its first case in Nigeria. So this is clearly an outstanding performance. Important because it will inform the development of the appropriate vaccine for the region. Although you have countries such as Gabon or South Africa or Kenya, which own currently level 3 and 4 laboratories. So these countries know how to deal with infectious diseases. This slide, if there is something to retain from this slide, is that the continent, or at least various countries in the continent, are ready to be part of the global R&D, at least in the infectious diseases. Oh yeah, so this is, I found that very interesting. These robots, 5 robots by Rwanda, which have been able to screen up to 150 people per minute and keep the medical record from patients of COVID-19. They were also able to deliver food and medication. And as the Minister of Communication, Technology and Innovation of Rwanda put it, technology has played a key role during the pandemic, not only in healthcare, but also in education, trade, and e-commerce. So I think that this will be leveraged beyond the pandemic, and I will touch upon this when I will discuss the strategies. Yeah, this is a huge setback for the continent. And this is the impact on the interruption of the tuberculosis and malaria services during the lockdown. The projections from the model conducted by Imperial College in London and by Johns Hopkins University in the US shows that between 2020 and 2025, there will be up to 1.5 million people who will die as a result of the undiagnosis or the untreatment that happened during the lockdown. So this is not something that is very promising for the continent. According to the WHO, the number of malaria deaths will double in 2020 only. And as you know, most of the deaths, 90% of the deaths from malaria happen in Africa. Yeah, I have organized the strategies in 2 colors. The blue color strategies are related to public health and healthcare, and the green, those which are in green, are related to the industry. So I think you may agree with me that there has been an increasing awareness among the public in low middle income countries or in the developed countries, that public sector is the best guarantor of global population and national population health. I will not be surprised to see an acceleration in the universal health coverage in low middle income countries, or a budget reallocation with some financing mechanism that will deliver maximum impact. I will not be surprised to see better preparedness and emergency planning for the next outbreaks, and definitely not, it will not be surprising to me to see the digital strategies being at the forefront, because digital technology and digital has played a tremendous role during this pandemic in keeping our lives flow smoothly. I hope that the low middle income countries will increase the budget for the R&D, but this is will be country driven, of course.